we as doctors take care of patients who are sick, heart attacks and strokes, and we often wonder, what could we have done to prevent this from happening in the first place? And so sometimes answering that question requires creative, sort of out-of-the-box solutions. So the Polypill is a fixed dose, multiple medications in one formulated drug of medicines that help to prevent cardiovascular disease by controlling blood pressure and controlling cholesterol. And so our particular Polypill in this study was a 4-in-1 single medication taken once daily to control blood pressure and to help improve cholesterol. We studied it where we think the need is greatest, in a community health center in Mobile, Alabama, with a really underserved population and a vulnerable population, and found that a Polypill, as compared to usual care, was effective in improving blood pressure and improving cholesterol for these patients. So we enrolled 303 participants in this study, and half of whom were assigned to take a Polypill once a day for 12 months. The other half were assigned to continue their usual routine medical care. We found at the end of a year that participants in the Polypill arm had lower blood pressure and better cholesterol than patients receiving their routine medical care. And so among the things that tells us is that there are potential key advantages to a 4-in-1 combination because it simplifies, it's convenient, and it's something patients can understand. And if they can just remember to take just that one pill a day, it really gives them a head start towards controlling blood pressure, controlling cholesterol, and by doing so, hopefully lowering their chances of experiencing cardiovascular disease. So as far as the research on Polypill, so it's interesting. The Polypill in the prevention of cardiovascular disease is not a new concept. It was introduced over 15 years ago, and it's been studied, but mainly abroad, mainly in third world countries and developing countries. What there hasn't been until our study has been a US-based study to enroll US patients and to really study vulnerable populations in the United States. And so this study, we think, should hopefully help to elevate the conversation about how we creatively engineer preventive strategies, not just around the world, but right here at home. So the Polypill, by virtue of its design, could be categorized as a one-size-fits-all approach. And in this era of precision medicine, it's important to emphasize that there is still a role for precision medicine and that the Polypill is intended really just as an advanced running start for people who need access to some medical care, but that precision medicine should still be deployed to add therapy and adjust therapy. And so it's not it doesn't have to be an either-or approach. We think there are advantages to combining population-based strategies like the Polypill with all the virtues of precision medicine, particularly because we sit really at the epicenter of precision medicine here at Vanderbilt.